After 3 decades of emergency medicine, treating thousands of cardiac patients in their most critical moments, I need to share something that could save your life. The statistics are sobering and undeniable. The majority of individuals over age 60 who experience cardiac arrest while alone do not survive to reach hospital care. This isn't sensationalism or fear-based messaging. This is medical reality supported by decades of emergency data. Nearly half of all cardiac-related fatalities occur before the patient ever arrives at a medical facility. Why does this happen with such devastating frequency? Because people waste the most precious resource they have: time. They hesitate when decisive action is required. They second-guess symptoms that demand immediate response. They panic instead of implementing the simple, proven interventions that can maintain circulation long enough for professional help to arrive. The brutal medical truth is this: without knowledge of appropriate emergency response protocols, you could experience irreversible damage or death within minutes of symptom onset. Every single day throughout my career, I've witnessed patients transported into emergency departments who would have survived with substantially better outcomes if they had simply performed 1 or 2 critical actions differently during those initial minutes at home. The presentation is often similar: crushing substernal chest pressure, sudden respiratory distress, profound dizziness, diaphoresis, cold sweating, and by the time emergency transport delivers them to our doors, the golden window of intervention has closed. The damage has been done, the muscle has died, the prognosis has darkened. But here's the critical information that changes everything. There exist evidence-based techniques, straightforward interventions you can execute immediately, even in complete isolation, that can double or even triple your survival probability. These aren't internet myths, unverified home remedies, or wishful thinking. These are legitimate medical strategies that cardiologists teach their highest-risk patients, protocols developed through decades of emergency medicine research. Throughout this comprehensive presentation, I'll guide you through 7 potentially life-saving interventions every person over 60 must understand to survive cardiac arrest when no one else is present to assist. These represent the exact protocols I wish every patient who ever entered my emergency department had practiced and understood before their cardiac event occurred. And you need to pay particular attention to intervention number 3. It's so remarkably effective that peer-reviewed research demonstrates it can represent the difference between permanent cardiac damage and walking out of the hospital with preserved heart function. The vast majority of people remain completely unaware of this intervention, but after today's presentation, you will possess this critical knowledge. Every medical reference, research study, and scientific publication I mention throughout this video is fully documented and listed in the description section below. You can independently verify every claim I make. Before we examine these 7 interventions in detail, I'd like to know something about you. What is your current age? Please share in the comments section. I personally review and respond to every single comment as though we're having a one-on-one consultation in my clinic. Your engagement matters. Now, without further delay, let's begin with intervention number 7. This represents the very first decision point that could determine whether you survive or become another tragic statistic. Number 7. Initiate emergency medical services contact immediately without delay. The absolute first and most critical intervention when you perceive any symptoms consistent with cardiac arrest is this: contact emergency medical services immediately. Do not delay. Do not engage in diagnostic speculation. Do not tell yourself reassuring stories like, "This is probably just indigestion," or "I'll wait and see if it resolves on its own," or "I don't want to bother anyone if it's nothing serious." Every minute you delay, every 60 seconds you spend hoping symptoms will spontaneously resolve, the damage to your cardiac muscle tissue expands and intensifies. Cardiologists express this concept in the simplest possible terms. Time equals muscle. The longer blood flow remains blocked or reduced to cardiac tissue, the more myocardial cells undergo irreversible necrosis and the lower your probability of survival with meaningful quality of life. The research supporting immediate action is overwhelming. According to comprehensive data from the American Heart Association, patients who contact emergency services within the first 5 to 10 minutes of symptom recognition demonstrate survival rates up to 50% higher compared to those who delay seeking help. Yet tragically, a substantial proportion of elderly individuals minimize or rationalize their symptoms. Clinical studies consistently show that nearly 1/3 of people over age 60 wait more than 2 hours before requesting medical assistance, frequently because they don't wish to inconvenience others. They fear being perceived as weak or dramatic, or they genuinely believe they can endure the episode through sheer determination. That hesitation, that delay, that misplaced stoicism frequently proves fatal. Consider this real-world scenario. A 68-year-old grandfather experienced unusual pressure in his chest one evening while watching television. He rationalized it as probably gas or indigestion, consumed some antacids and water, and settled into his recliner to rest, confident it would pass. He waited for hours, hoping the discomfort would fade. By the time his daughter discovered him in distress and contacted emergency services, the cardiac damage had progressed beyond salvage. Medical professionals informed the family that if he had sought help immediately upon symptom onset, he would likely have survived with minimal permanent heart damage. That scenario, that exact sequence of denial, delay, and devastating outcome, repeats itself thousands upon thousands of times annually across every demographic and geographic region, and it's entirely preventable through education and immediate action. So internalize this protocol. If you're over age 60 and you experience any of the following symptoms, crushing or pressure-like chest discomfort, sudden unexplained shortness of breath or respiratory difficulty, unexplained nausea, particularly when accompanied by other symptoms, that characteristic cold, clammy perspiration, or pain radiating to your jaw, neck, back, or left arm, you must act as though cardiac arrest is occurring until medical evaluation proves otherwise. Reach for your phone immediately. Dial emergency services without hesitation, even if subsequent evaluation determines it was gastrointestinal distress, anxiety, or another benign cause. You've lost nothing except a few hours of time. But if it is indeed a cardiac event, and statistically it very well could be, you've just executed the single most important survival action possible. Recognizing the urgency and making that call represents your first act of survival. But while you're waiting for emergency medical personnel to arrive, which typically takes 8 to 15 minutes depending on your location, what you do next can maintain circulation and purchase additional precious minutes. That brings us to intervention number 6, a technique with powerful clinical evidence for maintaining blood flow when every second matters. Number 6, administer aspirin orally by chewing if available and not contraindicated. Once you've contacted emergency services, your next intervention can literally represent the difference between survival and death. Take aspirin, but critically important, chew it rather than swallowing it whole. Why does the administration method matter so significantly? Because aspirin isn't merely an analgesic for pain relief, it's one of the most powerful antiplatelet medications available without prescription. Cardiac arrest typically occurs when a thrombus, a blood clot, forms and blocks blood flow through coronary arteries that supply oxygenated blood to heart muscle. Aspirin functions by inhibiting platelet aggregation, essentially thinning the blood and preventing the existing clot from enlarging, thereby maintaining some degree of flow until professional medical intervention can begin. The scientific evidence is unambiguous and compelling. A landmark investigation published in the Lancet Medical Journal found that aspirin administration during acute cardiac events reduced mortality risk by 23% among study participants. But here's the critical detail most people miss. Administration speed directly impacts effectiveness. Swallowing an aspirin tablet whole requires 10 to 12 minutes for the tablet to dissolve in your stomach and begin absorption through the gastrointestinal lining. Chewing the tablet thoroughly breaks it into small particles immediately, allowing the active pharmaceutical ingredient to begin absorption through the oral mucosa and stomach lining within just 2 to 3 minutes. In a crisis situation where every second of delay causes additional cardiac muscle death, those 8 to 10 minutes saved through chewing rather than swallowing can preserve heart tissue and dramatically improve survival outcomes. Consider this real-world case. A retired municipal bus operator, age 70, was alone in his residence when he experienced that characteristic crushing pressure in his chest. He immediately recalled his cardiologist's specific instructions from his last appointment, located the aspirin bottle in his medicine cabinet, placed one tablet in his mouth and chewed it thoroughly while simultaneously using his other hand to call emergency services. Responding paramedics later informed him that this simple, immediate action maintained adequate blood flow to prevent major cardiac damage. He was discharged from the hospital 2 weeks later, with preserved heart function and complete independence. But here's where many elderly individuals make critical errors. They either don't maintain aspirin in their home, they store it in locations that are difficult to access during an emergency, or they hesitate because they're uncertain whether it's medically appropriate for their situation. If you have a documented aspirin allergy, a diagnosed bleeding disorder such as hemophilia, or if your physician has explicitly instructed you to avoid aspirin due to medication interactions or other medical considerations, then you should skip this intervention. For everyone else, maintaining a bottle of non-enteric-coated aspirin in easily accessible locations represents one of the most practical emergency preparedness measures you can implement. Medical professionals typically recommend one standard 325 milligram tablet chewed thoroughly at the first indication of cardiac symptoms. Think of this intervention as deploying an emergency response team to slow the progression of disaster until more comprehensive help arrives. It doesn't reverse the cardiac event or eliminate the blockage, but it can prevent the damage from spiraling completely out of control. Acting with speed and decisiveness with aspirin administration keeps survival probability in your favor. But surviving cardiac arrest in isolation isn't only about pharmaceutical intervention. It's equally about how you position and move your body during those terrifying minutes. And that's where intervention number 5 becomes crucial. Number 5, remove restrictive clothing and assume upright seated position to reduce cardiac workload. When cardiac arrest strikes, every movement you make, every position you assume directly affects the amount of strain your compromised heart must endure. One of the simplest yet most frequently overlooked survival interventions is to immediately loosen or remove restrictive clothing and position yourself in an upright seated posture. Elderly individuals often dramatically underestimate how rapidly restricted circulation and poor postural positioning can transform a serious situation into a fatal one. Tight belts, constricting waistbands, buttoned collars, or restrictive undergarments compress blood vessels and impede your body's ability to circulate oxygen-rich blood precisely when that circulation is most desperately needed. Sitting upright rather than lying, supine relieves pressure on the diaphragm and lungs, facilitating easier respiration and reducing the workload demanded of your already failing heart. This isn't merely common sense or traditional wisdom. This is grounded in cardiovascular physiology. During acute cardiac events, your heart is struggling desperately to pump oxygenated blood through narrowed or completely blocked arterial passages. Lying flat forces the heart to work substantially harder, particularly in elderly individuals with compromised pulmonary function or pre-existing conditions like chronic obstructive pulmonary disease. By positioning yourself upright, ideally at a slight reclined angle with adequate back support, you accomplish several critical objectives: improved airflow into the lungs, reduced intrathoracic pressure, and more efficient blood circulation despite compromised cardiac output. A comprehensive clinical review published in the European Heart Journal specifically emphasized that positioning patients upright during acute cardiac distress significantly reduces pulmonary congestion, which is the accumulation of fluid in lung tissue that creates the sensation of suffocation and drowning. In practical terms, the way you physically position yourself can literally determine whether you maintain consciousness long enough for help to arrive, or whether you lose consciousness and collapse before intervention is possible. Consider this real-world example. A 74-year-old woman experienced chest pressure while working in her garden. Rather than lying down in panic, which would have been her instinct, she moved deliberately to a patio chair, loosened her gardening apron and the waistband of her pants, and positioned herself upright with her back supported while awaiting ambulance arrival. Her attending cardiologist later informed her that this single decision likely prevented syncope, loss of consciousness, and collapse before paramedics could arrive and administer supplemental oxygen. That small postural adjustment kept her heart from complete failure under maximum strain. This intervention is so straightforward that many elderly individuals overlook or dismiss it, but the physiological impact is substantial. If you perceive those characteristic warning signs, pressure sensation, respiratory difficulty, or cold perspiration, immediately sit upright in a stable chair. Relax your shoulders to reduce upper body tension and free your chest and waist from any restrictive clothing or accessories. Think of this as providing your struggling heart with the physical space and mechanical advantage it needs to continue functioning. This postural adjustment purchases critical stability. But to further maximize your survival probability, you need to maintain blood flow to your brain and cardiac tissue when circulation is severely compromised. That brings us to intervention number 4, a powerful physical action elderly individuals can perform during those desperate minutes before professional medical assistance arrives. Number 4, execute forceful coughing if consciousness begins fading to maintain cerebral perfusion. This intervention sounds counterintuitive, almost absurdly simple, but during acute cardiac events, forceful coughing can sometimes maintain consciousness long enough for emergency responders to reach you. Medical professionals refer to this technique as cough CPR, though it's important to understand that this term is somewhat misleading as it's not actual cardiopulmonary resuscitation. The physiological principle is straightforward. When you cough deeply and forcefully, your thoracic muscles contract powerfully, your diaphragm compresses upward, and substantial pressure builds within your chest cavity. That pressure mechanically forces blood out of the cardiac chambers and into cerebral circulation, maintaining consciousness when normal circulation is failing. Let's establish clear parameters. Cough CPR is absolutely not a replacement for professional medical treatment, and it's not a cure or definitive intervention for cardiac arrest. But it can purchase valuable seconds or even minutes if you experience profound dizziness, visual changes, or the sensation of impending loss of consciousness before paramedics can reach your location. Research published in the Journal of the American College of Cardiology demonstrated that repeated forceful coughing during cardiac arrhythmias maintained patient consciousness and prevented complete circulatory collapse temporarily until emergency intervention could be administered. In documented cases, patients remained alert and responsive for several minutes simply by executing forceful coughs every 2 to 3 seconds. Envision this scenario. A 69-year-old retired automotive mechanic experienced a sudden wave of profound dizziness during what was subsequently diagnosed as a massive myocardial infarction. Alone in his workshop, with no one nearby to assist, he recalled information he'd heard about cough CPR. He began coughing forcefully and repeatedly, and this intervention maintained his consciousness until emergency medical personnel arrived and began advanced cardiac life support. Attending physicians later informed him that those forceful coughs likely prevented complete circulatory collapse and subsequent brain damage before they could restore adequate cardiac rhythm and output. The underlying physiology is elegant in its simplicity. Syncope, loss of consciousness, during cardiac arrest results from sudden, profound reduction in cerebral blood flow. By coughing with maximum force, you create artificial mechanical compression of the heart, essentially manually pumping it with your thoracic muscles. It's not efficient and it won't stop the underlying cardiac event, but it maintains minimal oxygen delivery to brain tissue long enough for professional intervention to assume control. If you ever experience your visual field narrowing, your head feeling light or disconnected, or your body beginning to go limp during chest discomfort, implement this protocol. Take the deepest inhalation possible, then execute a forceful, explosive cough as though attempting to expel something substantial from deep within your respiratory tract. Repeat this cycle every 2 to 3 seconds without pause until the sensation of impending consciousness loss passes, or until emergency personnel arrive and take over. Think of this intervention as manually maintaining cardiac output when electrical and mechanical cardiac function is critically compromised. This unusual but potentially life-saving technique has documented success in emergency medicine literature. But once you've stabilized yourself to the degree possible, you also need to ensure that emergency responders can reach you without delay. That's where intervention number 3 becomes critical. Another seemingly simple but potentially life-saving preparation every elderly individual should implement. Number 3, unlock entry points and maintain communication device within immediate reach for rapid emergency access. When cardiac arrest occurs, every second matters profoundly, not just for your physiological survival, but for the people attempting to reach and rescue you. One of the most tragically overlooked survival interventions is also one of the most straightforward. Unlock your primary entrance and maintain your communication device within immediate physical reach at all times. This sounds almost trivial, but in actual emergency situations, it frequently represents the difference between being reached in time or being trapped behind a secured door while precious life-saving minutes evaporate. Here's why this intervention carries such critical importance. Emergency medical personnel are trained and equipped to force entry through locked doors if absolutely necessary, but every physical barrier, every extra obstacle consumes time. And during cardiac arrest, time directly equals cardiac muscle survival. Clinical research consistently demonstrates that for every 10 minutes of delay in definitive treatment, survival rates decrease by approximately 10%. Imagine losing those irreplaceable life-saving minutes simply because emergency responders couldn't access you quickly enough. Unlocking your entrance in advance completely eliminates that risk factor. Consider this devastating real-world case. A 73-year-old widower contacted emergency services after experiencing severe chest pressure, but he collapsed on his floor before he could reach his front door to unlock it. Paramedics arrived within 7 minutes, which represents excellent response time, but they were forced to waste additional precious minutes forcing entry through a secured door. By the time they finally reached him and initiated treatment, too much irreversible cardiac damage had occurred. Contrast that tragedy with this survival story. An 80-year-old woman living independently experienced classic cardiac symptoms, immediately unlocked her front door, clutched her mobile phone, and positioned herself in a chair directly adjacent to her entryway. Paramedics gained immediate unrestricted entry, initiated treatment within seconds, and transported her to the hospital where she received immediate intervention. She survived with only minimal cardiac damage and returned to independent living. The second component of this intervention carries equal importance. Always maintain your communication device within immediate reach, particularly if you live alone. Too many elderly individuals leave their phone charging in a distant room, sitting on a kitchen counter or otherwise inaccessible. During cardiac arrest, even walking a few steps can trigger complete collapse. Having your phone immediately accessible ensures you can maintain contact with emergency dispatch operators until help physically arrives. Some emergency medicine experts even recommend activating speaker mode so you can follow dispatcher instructions without needing to hold the device to your ear, freeing both hands for other interventions. Consider it from this perspective. Your phone represents your literal lifeline to emergency services, and your unlocked door represents the bridge that allows help to reach you without delay. Together, these two simple preparations eliminate barriers and recover time you absolutely cannot afford to lose. Once the pathway for emergency access is clear and optimized, the next critical step involves managing your physiological response to keep your body stable enough to survive until professional help arrives. And that's where intervention number 2 provides substantial benefit. Number 2, implement slow diaphragmatic breathing to reduce cardiac strain and optimize oxygen delivery. During acute cardiac events, panic represents your most dangerous enemy. When fear overwhelms rational thought, your body activates its sympathetic nervous system, the fight-or-flight response, releasing a cascade of stress hormones, including epinephrine and norepinephrine. This hormonal surge raises your heart rate dramatically, spikes blood pressure, and forces your already failing heart to work substantially harder. That's precisely why one of the simplest survival interventions you can implement is also one of the most physiologically powerful. Execute slow, controlled, deep breathing using your diaphragm. Deep diaphragmatic breathing accomplishes two critical objectives simultaneously. First, it maximizes the volume of oxygen entering your bloodstream and reaching your brain, both of which are desperately oxygen-deprived when circulation is compromised. Second, it activates your parasympathetic nervous system, which counteracts that stress hormone surge and signals your body to reduce heart rate and blood pressure. Research published in the Journal of Cardiopulmonary Rehabilitation and Prevention demonstrated that slow, controlled breathing patterns reduced heart rate and improved oxygen saturation, even in patients with advanced cardiovascular disease. It's not curative, but it provides your body with measurably better odds while you await professional intervention. Consider this powerful testimony. A 76-year-old retired nurse survived her cardiac event by focusing exclusively on controlled breathing. As the crushing pressure in her chest intensified and panic threatened to overwhelm her, she resisted that instinct. She positioned herself upright, closed her eyes, and began inhaling slowly and deeply through her nose, then exhaling even more slowly through pursed lips. By the time emergency medical personnel arrived approximately 12 minutes later, she was weak and in obvious distress, but she remained conscious and responsive. Her attending cardiologist later informed her that those steady, controlled breaths likely reduced the workload on her failing heart and maintained adequate oxygen delivery to her brain long enough for definitive treatment to begin. Here's the specific protocol to implement if you ever find yourself alone and experiencing cardiac symptoms. Place one hand on your abdomen rather than your chest to ensure you're using diaphragmatic breathing rather than shallow chest breathing. Inhale deeply and slowly through your nose, consciously feeling your belly expand outward. Then exhale gently through pursed lips as though you're blowing through a narrow straw. Aim for approximately 6 to 8 complete breath cycles per minute, which is substantially slower than your instinctive panic breathing. This pattern should be slow, controlled, deliberate, and focused. This type of diaphragmatic breathing not only reduces cardiac workload, but it also provides your mind with a focal point when panic attempts to take control. Think of each slow, deep breath as purchasing additional time. Time for oxygen to reach your brain tissue, time for your heart to reduce its oxygen demand, and time for emergency medical personnel to arrive and assume care. And if there's one additional behavioral intervention that synthesizes all these survival protocols together, it's the final and most critical one. The intervention at number 1 that clinical research demonstrates can double your survival probability. Number 1, maintain complete physical stillness and mental calmness to minimize cardiac oxygen demand. When cardiac arrest strikes, your immediate instinct might be to move, to pace anxiously, to attempt walking to find help, or even to try to walk off the discomfort. But that instinct, that movement, can prove fatal. The absolute number 1 survival principle is this: maintain complete physical stillness and mental calmness to the greatest degree possible. Every step you take, every unnecessary movement you make, forces your weakened, compromised heart to pump harder and demand more oxygen. And during cardiac arrest, your heart is already operating under catastrophic conditions with severely reduced or completely blocked blood supply. By keeping your body completely still and your mind as calm as circumstances allow, you minimize cardiac workload, conserve available oxygen, and provide yourself with the maximum possible chance of surviving until professional help can reach you. The underlying physiology is clear and undeniable. During myocardial infarction, blood flow through coronary arteries is blocked or severely reduced. Physical movement demands additional oxygen from cardiac muscle tissue. But with oxygen supply already critically compromised, that additional demand only accelerates cellular death and tissue necrosis. A landmark clinical investigation published in the European Heart Journal found that minimizing physical exertion during acute coronary events significantly reduced complications and improved both short-term survival and long-term outcomes. In straightforward terms, elderly patients who remained still and calm survived at substantially higher rates than those who moved around in panic. Consider this compelling real-world example. A 71-year-old farmer experienced crushing chest pressure while performing equipment maintenance. His immediate thought was to climb a ladder to retrieve his mobile phone from an elevated location. Instead, he forced himself to remain exactly where he was and called for assistance from that position. Responding paramedics later informed him that remaining still prevented his heart from complete failure under additional stress. He survived with far less permanent damage than medical professionals initially anticipated. Maintaining calmness isn't purely physical, it's equally mental and emotional. Panicking floods your cardiovascular system with adrenaline, which raises blood pressure and worsens the underlying cardiac event. By focusing consciously on remaining still and implementing slow breathing techniques, you reduce that hormonal surge and help stabilize your body's physiological state. Tell yourself explicitly, I have contacted emergency services. My only responsibility now is to remain completely still and breathe slowly. This mental framework prevents impulsive decisions like attempting to walk to your door, reaching for objects across the room, or other actions that can trigger complete cardiovascular collapse before help can arrive. Think of your heart during cardiac arrest as a severely damaged engine operating on its absolute last reserves. Every movement revs that engine faster and increases the risk of complete catastrophic failure. Stillness, calmness, and conserving every possible unit of energy represents the key to purchasing time. This represents the final, most powerful behavioral intervention. Do less, breathe more, and allow help to reach you. Together, these 7 interventions form a comprehensive survival protocol, and while you cannot predict with certainty when cardiac arrest might occur, knowing exactly how to respond can represent the absolute difference between tragedy and survival. And there you have the complete framework, 7 evidence-based, life-saving interventions every individual over 60 must understand to survive cardiac arrest in isolation. From initiating emergency services contact immediately, to administering chewed aspirin, removing restrictive clothing and assuming upright posture, executing forceful coughing if consciousness fades, unlocking entry points and keeping communication devices accessible, implementing slow diaphragmatic breathing, and finally maintaining complete physical stillness and mental calm. Each individual intervention purchases precious time, and in cardiac emergencies, those minutes, those seconds, can represent the absolute difference between survival and death. Internalize this critical truth. Cardiac arrest doesn't typically provide second chances. But if you act with speed, think with clarity, and implement these evidence-based protocols, you can survive and live to see many more years with your loved ones. The scientific evidence is overwhelming and unambiguous, but it only provides benefit if you're prepared and ready to act decisively. Now I want to hear directly from you. Where are you watching from? And do you currently maintain aspirin or another emergency preparation plan readily accessible in your home? Share your response in the comments below. We personally read and respond to every single comment because your story matters profoundly, and your survival preparation tips could help save someone else's life. Don't forget to give this video a thumbs up. Share it with family members and friends, and subscribe for additional evidence-based medical content. Remain safe, remain prepared, and remember that knowledge represents power, particularly after age 60. If you have any questions or wish to share your personal experience with cardiac events, please don't hesitate to leave a detailed comment below. We're always listening and always here to help. Thank you for watching and investing this time in potentially life-saving education.